the fundamental issue is that marijuana as a crude plant extract is not medicine. It is a collection of between 60 and 80 cannabinoids and in the hundreds of other compounds. I know that some of those compounds are therapeutically useful. There is medicinal value in those compounds. But in the United States, we have decided that we want our prescription medication supply to be safe and effective. And the way we've done that since 1906, when we started this process, and we now have the Food and Drug Administration, is for products to be taken to the Food and Drug Administration for their evidence-based evaluation for the purity, the standardization, the bioavailability of those products to be evaluated. They go through clinical trials to establish safety and effectiveness. A dose is determined in order to achieve the effective benefits and minimize risks. The possible adverse reactions and side effects are all enumerated. Any adjustments that I need to make based on kidney dysfunction or liver dysfunction are included, so I can make a responsible professional judgment about prescribing that compound. What we're voting on November 6th is not the concept of compassion. It's not the idea that there might be some medicinal value in marijuana for some people, but rather we're voting on 6 pages of specific words which become law without any change on January 1, 2013. For physicians, the biggest loophole is that in the list of debilitating medical conditions, the writers of this ballot initiative have inserted a loophole which is big enough to drive a Mack truck through. And that says that any physician can authorize marijuana for any condition that that physician chooses. So now, instead of having a law which is restricted to a very small number of folks who have come forward and said, marijuana helps us with our health and well-being. It helps our quality of life. Now we've expanded that to what we've seen in California and Oregon and Colorado, where tens and hundreds of thousands of people are carrying cards, and the basis for those cards is stress, is insomnia, is anxiety, a whole array of conditions, none of which have been shown medically to be appropriate diagnoses, even for the crude plant extract. I'm all in favor of pursuing the medication route that we've chosen with opium. We don't smoke opium. We administer morphine. We don't chew willow bark. We administer aspirin or other non-steroidal anti-inflammatories. That's the route we need to go with marijuana.